This 5-minute video is designed to give the audience a brief overview of sleep and drugs. The presentation will cover the Z-class, barbiturates, benzodiazepines, and alternative non-medicinal sleep aids. You will be introduced to how the drug works to induce sleep, side effects, withdrawal symptoms, dependency, tolerance, and examples from each drug class. The Z-class drugs are non-benzodiazepine hypnotics that work on benzodiazepine receptors but are structurally unrelated to benzodiazepines. This class exhibits a similar level of efficacy but are shorter acting. Side effects vary between each drug and include dry mouth, abdominal pain, headache, and nausea. Dependency among Z-class drugs varies, but is consistently less pronounced than observed among benzodiazepines. Overuse is possible, and withdrawal may result if drug use stops abruptly. Users may experience typical withdrawal symptoms such as anxiety, irritability, insomnia, and mood swings. Overall, Z drugs may be less habit-forming and addictive, but should only be taken on an as-needed basis. Examples from this group that are available today in North America include Ambien, Sonata, and Lunesta. Benzodiazepines enhance the effect of gamma-aminobutyric acid, or GABA, which acts as a sedative and shortens the amount of time spent in bed before falling asleep. The following 2 short video clips illustrate the effects of GABA, first without benzodiazepines, and secondly with benzodiazepines. Benzodiazepines aid in increasing sleep time and reducing wakefulness, although it's generally light sleep that is increased and deep sleep is decreased. Some side effects of taking benzodiazepines include rebound insomnia, reduction in slow-wave sleep, anxiety, and agitation during withdrawal. Due to their addictive and habit-forming properties, benzodiazepines are typically taken for limited long-term use, as overdose is easily achieved and can lead to deep unconsciousness. Some examples of benzodiazepines include triazolam, or commonly known as Halcion, and temazepam. Barbiturates act to depress the central nervous system and are often grouped into short-acting, intermediate, or long-acting, as each group is used for different purposes. For example, short-acting barbiturates are used in general anesthesia, as this group allows the anesthesiologist greater control. Side effects of using barbiturates as a sleep aid include dizziness, involuntary eye movement, lack of coordination, and death. Some examples of barbiturates used as sleep aids include phenobarbital and thiopental. The next section of this presentation covers non-medicinal sleep aids. Valerian is thought to act on benzodiazepine receptors. However, results mostly show the presence of the placebo effect. Melatonin is produced naturally in the pineal gland and acts as a major part of the sleep and wake cycle in humans. In the drugstore, there are many melatonin supplements available, and for the majority, they are sold in unnecessarily high doses. There are some general risks and interactions to consider before incorporating sleep aid medications into your nighttime routine. Mainly, mixing sleep aids with alcohol, opioids, or other central nervous system depressants can lead to respiratory failure and even death. Before using a sleep aid, it is often recommended that you assess your sleep hygiene. Sleep hygiene is defined as the controlling of all behavioral and environmental factors that precede sleep and may interfere with restful sleep. It's the practice of following guidelines in an attempt to ensure more effective sleep, which can promote daytime alertness and help treat or avoid certain types of sleep disorders. Trouble sleeping and daytime sleepiness can be indications of poor sleep hygiene. Below are some suggestions to improve your sleep hygiene, including establish a regular sleep schedule, expose yourself to light first thing in the morning, avoid lengthy or late naps, do not drink or eat too much before bed, and maintain a quiet, dark, and comfortable sleep environment. Although we sound like we know what we're talking about, always consult a physician before taking any medication.